Mosquitoes are found worldwide and usually pose no harm other than itchiness that comes from being bitten. One kind of mosquito only, the female Anopheles, can transfer malaria, a serious disease affecting millions. When a mosquito takes blood from an already infected person, it will take up some parasites too. Now the next time the mosquito goes to bite someone else, the parasites will get injected into the person's blood, giving them malaria. Since mosquitoes need hot temperatures to survive, malaria is usually found in warmer parts of the world. Although it occurs in the Middle East, Caribbean, and Central and South America, it's most commonly found in sub-Saharan Africa because of how rapidly the mosquitoes transmit the disease. And the most dangerous form of the parasite is also found most commonly in Africa. Within this area, there are even greater vulnerable populations, like those with weak immune systems, so their body can't fight back the disease. This includes young children and infants, and pregnant mothers, along with people with HIV/AIDS. People living in rural areas with a lot of open land compared to cities with buildings and infrastructure with high-density populations are also more vulnerable to malaria. Because malaria is known to be a blood disease, it can be passed through similar blood-involving procedures like a blood transfusion, sharing of medical equipment like needles, which may have traces of blood, and organ transplants. Also, a mother with malaria can pass it to her baby during the time of delivery, or even before delivery to her unborn infant. If someone sitting beside you has malaria, there is no risk of transmission, and it is not sexually transmitted either. To better put into perspective how severe this disease is, in 2019, about 94% of the world's malaria cases and deaths were in Africa. Malaria is one of the leading causes of child mortality. One child dies every 1 minute from malaria in Africa, where it is estimated that 9 out of 10 malaria deaths occur. There are many prominent symptoms of malaria to look for and monitor. These symptoms usually develop 10 to 15 days after being bit by the malaria-carrying mosquito. Shaking chills, muscle aches, and fatigue or tiredness are common. Nausea, fevers, diarrhea, headaches, and vomiting may also develop. Slightly less common is jaundice, which is a yellowish coloring of the eyes and skin. At first, it may be difficult to recognize these as symptoms of malaria, and if medical care is not provided within 24 hours, then the disease can become severe and cause mental confusions, kidney failure, seizures, coma, and in the most extreme cases, death. While this may seem worrisome at first glance, there are many steps that one can take to prevent themselves from getting malaria. Prevention is the best and most effective way to reduce malaria transmission. The World Health Organization, a leader in public health information, recommends that pregnant women get 3 doses of preventative treatment during the first trimester, the 3 months of pregnancy, and for children living in Africa, a hotspot for malaria, they are also advised to get 3 doses of the same treatment alongside their routine vaccinations to prevent malaria. After getting the disease, if diagnosed early and provided with the most promising prescription drugs, malaria can be controlled. This is dependent on the type of malaria, location of infection, age, severity of sickness, and if they are a vulnerable population, such as pregnant women. But because early diagnosis is not always possible, it is most effective for individuals to use personal protective measures to prevent infection in the first place. Let's start with the simplest and fastest to implement approaches. Wearing long-sleeve shirts and pants can prevent mosquitoes from finding a landing spot to draw blood. Insect repellent on the rest of the exposed body parts such as the hands, neck, and feet in open-toed shoes can provide a safeguard for remaining areas of skin. This is most important at night because that's when mosquitoes are most active. On a similar note of nighttime protection, insecticide-treated mosquito bed nets can greatly reduce the contact between humans and mosquitoes through 2 mechanisms. There's the physical net itself, too small for mosquitoes to pass through, and insecticide, which is a chemical that is poisonous to mosquitoes and kills them and prevents them from reproducing. Window nets on all windows of the houses also prevents mosquitoes from entering indoors in the first place, and coupled with the net beds, protection is maximized. Indoor residual spraying is another mechanism to reduce malaria transmission, where the inside of houses is sprayed with insecticide once or twice a year. Mosquitoes breed in stagnant water, meaning they lay eggs in any area that has water standing still in it. This includes swamps or depressions that collect water, but also buckets or barrels of water. While swamps are out of individual control, families can cover any buckets or barrels where they store water with a simple wooden cover so mosquitoes don't lay their eggs there. You may now be wondering about vaccines for malaria. Currently, only one vaccine exists to reduce malaria in young children, and the World Health Organization recommends a slow introduction of it to certain parts of sub-Saharan Africa. In 2019, Ghana, Kenya, and Malawi were three of the countries that started to administer the vaccine in places where malaria transmission was high. However, additional testing is ongoing before completely widespread routine use occurs. So until then, make sure to take the preventative steps of covering skin with full-length clothing, using insect repellent, insecticide mosquito nets, covering stagnant water, and using indoor spray. If you experience any of the symptoms, shaking, chills, muscle aches, tiredness, nausea, fevers, diarrhea, headaches, and vomiting, immediately go to the nearest medical center to prevent worsening of conditions and treat malaria fast. Malaria is a global health issue and still requires a lot of further studying before we as a society can overcome it. But with increased knowledge of the disease, you can take steps now and keep your family, community, and yourself safe.